Dear audience, good morning. Today we have the corrective orthodontics. First of all, we have to divide in general the orthodontics to four branches: the preventive orthodontics, second interceptive orthodontics, third corrective orthodontics, and finally surgical orthodontics or orthognathic surgery. The corrective orthodontist deal with the uh, existing malposition or existing malocclusion. That means the corrective orthodontics is the phase or art and science of orthodontics that recognize, diagnose, and management of the already present malposition of teeth or malocclusion of the dentofacial complex. And it's different from the preventive orthodontics, where the preventive orthodontics it's prevent any condition that may cause any change in the normal occlusion. The corrective orthodontics include the management of intra-arch problem like crowding spacing or management of transverse malocclusion include the cross-bite cases, management of vertical malocclusion include the open bite, deep bite, and management of sagittal malocclusion, which include the class 1, class 2, and class 3 cases. The management of intra-arch problem, the crowding, spacing, median diastema, and other local factors. The crowding of arch include the classification, diagnosis of crowding, space analysis of crowding, and management of crowding. Always the classification of crowding either according to the location of the crowding, which classified either localized crowding or generalized crowding, or according to the etiology of the crowding, which are classified to the primary, secondary, and tertiary crowding. According of severity, the crowding is classified into the mild crowding, moderate crowding, and severe crowding. Or the classification of the crowding according to the etiology, we have the primary crowding and also called the hereditary crowding. The second classification is the secondary crowding or environmental crowding, and finally the tertiary crowding or called the late lower incisor crowding. The primary crowding or called the hereditary crowding, also called the tooth size and arch size discrepancy. That means the ratio between the tooth size to the arch size increased. This ratio increased either due to increase in the tooth size or the tooth size present on small arch size, and this cause increase in the ratio and cause crowding, or the normal size of teeth on a small size of arch, and this also increase the ratio of tooth size to arch size discrepancy and called primary crowding. The genetic or the hereditary factor is determine the size of the teeth and the size of the arch. So it's the primary crowding is called the hereditary crowding. The second type of the secondary crowding or environmental crowding. In secondary crowding, there is a local factor cause the generalized or localized crowding. One of these, the local factor, either the retained primary teeth in this case and cause lingually position of the permanent incisors and localized crowding in the anterior area, or in the opposite, the early loss of the primary canine in this case cause crowding in the anterior teeth, and this crowding in the anterior teeth is due to the local factor that cause secondary crowding. That means the crowding is secondary to local factor. Classification or of crowding is the tertiary crowding or late lower incisor crowding. Crowding, uh, from its name, it's multifactorial and occur at late age of adolescence after 18 years old. Like in this case. And the factor that cause the tertiary crowding or late incisor crowding, first of all, is the forward growth of the mandible, either either horizontally forward growth of the mandible or rotation of the mandible forward. The rotation of the mandible forward or the horizontal growth of the mandible in forward direction. At the same time, the maxilla is slow in growth than or slower in growth than the mandible, cause crowding of the lower incisor together with the pressure of the soft tissue in the teeth cause reduction in the lower arch uh, parameter and labial segment crowding. The other factor that causes the tertiary crowding is the mesial migration of the mandibular posterior teeth anteriorly or mesially due to the pressure of the transeptal fiber of the posterior teeth and cause an anterior component of force of occlusion that push the anterior teeth and cause crowding. The third factor is the soft tissue maturation of the tongue and lip that cause pressure or change the force on the labial segment or the incisors that cause the uh, late incisor crowd. Finally, the presence of third molar. The third molar here prevents the pressure that developed anteriorly due to the mandibular growth or soft tissue pressure. And this pressure should be dissipated distally, but the presence of the third molar prevents the dissipation of the pressure of the soft tissue and mandibular growth forward to dissipated distally, and this causes late incisor crowding. There is a controversy in the role of the third molar or the cause of the third molar of the late incisor crowding. But most of the research that found a weak evidence about the effect of the third molar on the late incisor crowding. So the extraction of the symptomless of the lower third molar may be not to prevent the labial, the lower incisor crowding, and the most factor that caused the lower incisor crowding is the forward growth of the mandible and the mesial migration of the soft tissue.